Imagine, you're at a nice family dinner with your loved ones. Perhaps you just settle into bed with your significant other after a nice date. Maybe you're paying the cashier at the local convenience store, and whap! Your friendly store clerk, sweetheart, or Auntie Joe brings their hand across your face in an unexpected fit of perceived rage. This is the epidemic that is currently plaguing our nation. What is it? How can it be stopped? Is there a cure? Stay with us as we examine this bizarre phenomenon in all its strange wonder. Dustin and Tessa, a young couple living together in this quaint home, are finding their relationship plagued by this new problem.
It's become such an issue in our relationship. I can't even make myself breakfast without him slapping me.
She got the disease first. It started one day when I came home from work, and what I thought would be a nice greeting home was a slap in the face.
At first we used protection. I would wear a glove so he wouldn't contract the disease, but in a moment of intimacy we went without.
I mean, I love her to death, but these slaps really need to stop. We're really starting to resent each other.
While countless doctors have dedicated countless hours to research to help those such as Dustin and Tessa, a cure for this slapidemic has remained elusive. Dr. Eugenia Miller is one of those doctors who has been working since the disease's discovery.
With my grant through the National Center of Health, I've been able to make a number of breakthroughs in understanding how this disease functions. Here we have the nerve-affected region, known as a hand. It then interacts with the nerve receptor base, also known as a face. When these two properties collide, it creates a final condition, known as sad face. Although victims may also display symptoms of angry face, wow, they yell cold face, and even rare instances, I kind of liked that face, which brings us full circle.
While researchers have continued to wage war against this devastating disease, a cure could not come soon enough for Amy.
It all started a couple months ago when the epidemic began. I was on my way to visit my grandmother, who was losing a battle to cancer in the hospital. And as I was walking into the building, this crazed patient just ran up to me and just slapped me right in the face. They restrained him, the doctors, they restrained him before he could do any serious damage, but it was too late. He was infected, and I didn't even know it. I started to feel a little bad when I was walking there. My palms were tingling and sweaty. I got into my grandmother's room and she looked me right in the eye and she said, "Amy, I really love you." And I just slapped her right in the face. The doctors pulled me back, but It was too late. She'd already passed before I even left the room. Before I even had a chance to tell her that I loved her too.
These stories are not the only ones. This disease is affecting men, women, and children nationwide. It is of the utmost importance that you protect yourself. If you suspect a hand approaching your face from someone you know or a stranger, duck down low to the ground to avoid physical contact. When in public places, be wary of sudden movements, and if you do fall victim to this disease, try to practice vigilance and fortitude. May God have mercy on your soul.